करवावहे तेजस्विनावधीतमस्तु मा विद्विषावहे ॐ शान्ति शान्ति शान्तिः. So very good morning. So we are on the second day of the ninth webinar on the integrating yoga therapy to combat psychological and respiratory problem of COVID-19. And yesterday we had a very wonderful session on the day of International Yoga Day. I hope that everyone would have a very fruitful experience. And as the International Yoga Day was observed yesterday, the theme was to yoga at home and yoga with family. That was the theme. So naturally, many of you would have practiced yoga yesterday. So once again, I'm happy in welcoming the speaker, the resourceful resource person, Dr. D. Sendil Kumara Raja, the Fitness Canada Physio and Massage Center, for his wonderful session yesterday, and also today also you will be having a very fruitful session. And yesterday he was just briefing you on the how the yoga, especially the pranayama and other aspects, right? How to combat respiratory problems of COVID-19. And today we are, I think he will be more focusing on the how to overcome the psychological problems due to this, COVID-19, and as well as in general also. In general also, many of us will be having a lot of psychological issues, because yoga, as I told you yesterday, is a very traditional practice of India, and it will really help you to overcome the psychological problems that we have and many of us have been facing. And I am happy to welcome once again Dr. Sendil Kumara Raja to the session, and my own colleagues, Dr. Ilango, Dr. Jerida, and the organizing secretary and the coordinator of this 2 days program, Dr. Nirmala, Dr. Rajavel, and the guest faculties, Dr. Suresh Kumar, Dr. Karthikeyan, and the technical skilled personalities, Dr. Selvamani, John Milton, Leone, and Puhal Jodi. And very important thing is the you all, that is the participant, as I told you yesterday. And we have 12 participants from 12 countries and representing from almost all the states of our country. I hope that this today's session will also be a much of beneficial to you and have a fruitful session. Now, with this few word, let me welcome Dr. D. Sendil Kumara Raja to take over the session. Thank you.
Thank you, sir. Is everything okay?
Yes, yes. Your PPT is seen now.
Yeah.
Yes.
Start with the prayer again. Om Sahana Bhavatu Sahanau Bhunaktu Saha Viryam Karavavagai तेजस्विनामधीतमस्तु मा विद्विषावहै ॐ शान्ति शान्ति शान्तिः. Welcome back, everyone. Hope you all had a peaceful sleep last night. I'm really happy to be back with you all. I thank all the organizers and eminent professors for giving me this opportunity. In today's session, we are going to address mainly how we can integrate yoga therapy in behavioral therapy for COVID-19 related psychological complaints. It's quite a vast topic. I will try to make justice by trying to complete the whole session. In case if I can't, I might have to skip a couple topics at the end. Please bear with me and please follow me closely if you have any questions particularly related to the topic. Let's stick on to the topic because it's a very vast subject. We are trying to integrate yoga into behavioral therapy. Behavioral therapy itself is a huge science on its own, and yoga is another huge science and ancient wisdom. So it's going to be really a tough task to complete the entire stuff. And today we are not going to just see based on the scriptures, okay, the scriptures say this, so that you have to do all these stuff like in yoga by which you can be benefited. We are not going to go that way. We are going to see the scientific foundations of these yoga techniques which have been followed for centuries, like from a very ancient time. So we are going to see how they are scientifically based. So this session will be mostly science-based. If you are not inclined to science, probably you might feel a bit boring this today's session. Please bear with me. End of the session, we are going to share some very important techniques. I might not be able to demonstrate everything, but I will definitely demonstrate those which are very important and relevant to the current technique. Of course, today we all are living in a very tough period. We all know living through the pandemic itself is really a tough task, but the shadow of the pandemic, which is going to be on the economy of families and the country, and also on the psyche of the individuals and families, it's going to be really difficult, and it's going to take much longer time to recover from this economic as well as psychological impact of this pandemic. Probably if there is a vaccine or something in place, some medicine in place, this pandemic is going to subside, like it's going to go. But the after effects of this pandemic on the economic front as well as psychological front, it's going to take much longer time than we expect. The Times of India has reported that there is a huge rise in the cases of depression and anxiety during the lockdown. It's obvious and it's expected. So we need to see how we are going to tackle them. So while countries around the world continue to mobilize to contain the spread of the coronavirus, mental health experts say we can't lose sight of another alarming issue, the long-term mental health impact the pandemic is going to leave on the society. So such public health emergencies like COVID-19 will have implications on both individual as well as society. On individuals, we have insecurity, confusion, emotional isolation, stigma other than our economic loss, and of course, job insecurity. On the society, definitely society is facing a huge economic loss from loss of lots of businesses, work and school closures, inadequate resources for medical response, deficient distribution of necessities, particularly deficiency of the PPE, personal protective equipment for our medical and healthcare providers, who are the main frontline people who are working against the spread of COVID-19. The main root cause of all these mental health problems, as we all know, is the fear and sense of uncertainty. We definitely don't know how long this pandemic is going to take before it ends, and how many people are going to be affected, and what are all going to be the implications of this pandemic. This sense of uncertainty definitely creates fear that causes anxiety in people. Of course, prolonged anxiety, of course, it's already almost 7 months now from the start of the disease. Even though it is quite recent that India is facing trouble. Initially, India was really doing good when we in North America, we were facing a real tough situation here. Then India was doing really good, but now here it looks like it's getting a bit better, but we are really worried about India now, where the number of cases are really going up. So we don't know how long it's going to take. This prolonged anxiety is going to definitely cause some frustration, leading to depression. So there are several behavioral therapies that to address the problems faced, the psychological problems faced by individuals. One main frontline therapy available nowadays is the behavioral therapy, cognitive behavioral therapy. They all are following certain cycles of our mind. Mainly the cognitive behavioral therapy follows this simple cycle of thoughts, provoking feelings, and behaviors are the results of the thoughts and the feelings. So when we follow such modern behavioral therapy, there are certain shortfalls. We need to fill those gaps. That's where we come into the integrating yoga into the behavioral therapy, which will give a more holistic approach in order to address the psychological problems faced by people. There are several psychiatric and psychological measures available in the modern days of management of these illnesses. Integrating the ancient wisdom of yoga along with modern behavioral therapies have proven very effective in augmenting the outcomes. There are numerous scientific research-based documents supporting the effectiveness of such integrated approach. The disclaimers, again, these are only for educational purposes and not a medical advice. Please do consult your doctor or therapist before starting if you have any specific complaints, existing complaints. COVID-19 has various other associated problems which needs multifactorial approach. These yoga techniques could be one of the most important part of it, but surely not all. So in today's session, I have organized in the following broad sections: Yoga Integrated Behavioral Therapy, YIBT. We are going to see the psychopathological basics, the neurobiological background of the symptoms, and pathophysiological foundations in therapeutic interventions, and the techniques that we have chosen in Yoga Integrated Behavioral Therapy. Coming to the psychopathological basics, let's talk about anxiety. So what is anxiety? Is anxiety a disease? No, definitely not. Anxiety cannot be a disease. It is an emotion like love and affection, joy and compassion. Like any other emotion, anxiety is also an emotion. We need anxiety to perform better in a given situation. Like, for example, I have anxiety right now. If I don't have the emotion of anxiety right now, probably I'm not going to do a good job here. So we all need anxiety as an emotion in a given situation, which helps us to come out and perform better every time so that the results are better. We can contribute better to our society. So anxiety is a normal reaction to danger, the body's automatic fight or flight response that is triggered when you feel threatened, under pressure, or are facing a challenging situation, such as a job interview, exam, or a presentation like what I'm doing now, etc. In moderation, anxiety isn't necessarily a bad thing. It can help you to stay alert and focused, spur you to action, and motivate you to solve problems. But when this anxiety becomes a disease, before seeing that, we will see the common signs and symptoms of anxiety. People feel nervous, restless, or tense, having a sense of impending danger, panic, or doom. This is what we all are facing nowadays with this pandemic situation. An impending danger and an uncertainty, having an increased heart rate, breathing rapidly, sweating, trembling, trouble concentrating or thinking about anything other than the present worry. So the main problem is this worry will take over the person. He cannot think about anything else other than thinking only about that particular worry. Having trouble sleeping, experiencing gastrointestinal problems. I've highlighted that point. I want you to note down. Why do you get gastrointestinal? If you had any prolonged anxiety, you have seen how it affects your gut. So why do we get gastrointestinal problem if it is just a psychological issue? There is some connection that which yoga utilizes to influence the brain. We will be discussing about it in this session today. Having difficulty controlling worry. So these are all the common symptoms everyone gets when in an acute attack of anxiety. But that becomes a disorder when anxiety is constant or overwhelming, when worries and fears interfere with your relationships and daily life. You are likely crossed the line from normal anxiety into the territory of an anxiety disorder. I'm sorry. So that fine line is very delicate. You never know when you are crossing that fine line. What we are trying to treat here is not a person's anxiety. It is if a person has an anxiety disorder. That is what people, any healthcare provider will tend to treat. So the common types of anxiety disorders, I think we can go a bit faster here. These are general idea, probably most of you will be knowing. Types of anxiety disorders: general anxiety disorder, GAD, which is very common, obsessive compulsive disorder, a panic disorder, social phobia, specific phobia, and post-traumatic stress disorder. These are all common classification and types of anxiety disorders. A prolonged anxiety disorder, if someone is facing a prolonged anxiety disorder, it eventually leads to frustration in life, and a prolonged frustration and prolonged worrying leads to this condition called depression. Depression is classified as a mood disorder. It may be described as feelings of sadness, loss, or anger that interfere with a person's everyday activity. Like anxiety is not a disorder, but depression is. Clinical depression: one must experience 5 or more of the following symptoms over a 2-week period. So you can do a self-checkup now. So number 1, feeling depressed most of the day, loss of interest in most regular activities, significant weight loss or gain, sleeping a lot or not being able to sleep, either end, either this way or black and white. I'm sorry. Slow thinking or movement, fatigue or low energy most of the days, feelings of worthlessness or guilt, loss of concentration or indecisiveness, recurring thoughts of death or suicide. This is very important, the last one. People, in spite of having so much fortune and wealth, they still feel depressed and they can lose their life. So we will see certain techniques that we can follow from the yoga tradition, how we can counter these feelings of depression and suicide in this session today. So all the root cause of all these problems, whether it is anxiety, depression, frustration, the main root cause is this one, the stress. Stress can be defined generally as responses to demands upon the body. It is the body's reaction to a change that requires a physical, mental, or emotional adjustments or response. Here, I want you to note down this word change. It is the body's reaction to a change that requires a physical, mental, or emotional adjustment. See, we all are about to undergo a change. That change which we are not very comfortable with, that is our main problem of getting stressed. As long as you are in your comfortable zone, you don't feel stressed. But when you have to come out or outgrow from your comfortable zone, you probably feel stressed. That problem is mainly problem of getting accommodative to any changes. It can come from any situation or thought that makes one feel frustrated, angry, nervous, or anxious. Conceptually, stress can be any threat, either real or perceived, to the well-being of an organism. It's of basically two types. One is systemic, physiological. Other one is processive or psychogenic. In the systemic side, it is a real threat to well-being, physical, like when there is a real injury, if there is a real threat, physical damage, then whatever stress you are getting out of it is real, and you feel the real. You can feel or see the damage happening. On the other side, it's processive. It depends upon one's perception. Quality of stressful stimulus depends upon the interpretation of the situation. It depends upon a person's understanding of the presenting situation. The severity of the stressor and its physiological impact can vary amongst the individuals. Like, right now, we all are having difficulty facing this pandemic, but there are certain businesses which are making real huge profit out of this pandemic. Like, say, for example, those who produce all these masks and other hand sanitizers and other stuff, they capitalize on the current situation. But many other businesses are struggling to make any profit. So it depends upon how you see a situation. So that is the psychogenic stress that many people are facing now. So there are 5 stages of stress. The first one, fight or flight, stage of damage control, stage of recovery, stage of adaptation, and stage of burnout. Fight or flight. It is important to understand these stages because you will know where you are in case if you have a stress problem. In which stage are you? Depending upon the stage, you can take the interventions. You can act accordingly. The moment sorry. The moment you first feel stressed, oh my goodness, your body lets you know. It sounds the alarm. This alarm is very important, and everyone who faces stress will notice this alarm the body gives. And activity in the SAM axis. See, I'm going to talk about few axes here. You have to remember this is the first axis, SAM axis. What is that? Sympathetic adrenomedullary axis. This activity of this axis is increased. So what will happen? So when you don't pay attention to these alarms, other things within your body starts happening. There is an increase in stress hormones. This is what happens when this SAM axis is activated. So heart rate increases, blood pressure increases, and even a decrease in the short-term memory and feelings of stress, fear, anxiety, and depression all follows. Now, the flip side to all this is that in the alarm stage, your mental focus also tends to increase. Like how when I told that when I started presentation, I'm anxious and I had stress, but my focus increases so that I can give a better outcome. You know, we need it, but we have to come out of that stress and anxiety as soon as possible. Not for long, but initially. The stage is intended to solve an immediate problem and then return levels to normal. Stage 2, damage control. When your body feels stressed, it knows it. What happens then is does its best to keep things as normal as possible while your body works overtime. The SAM axis tries to combat with your stress level initially, but it doesn't support you for a long time. Then comes the HPA axis. What is that? Hypothalamic pituitary adenocortex axis. This axis, if activated, what happens? And anti-inflammatory hormones, that's where cortisols comes from, are secreted in order to control the inflammation that's happening. This stage allows the body to continue fighting a stressor long after the alarm reaction dissipates. But this is not a long-term solution. It's a quick fix. Usually this HPA axis comes into effect maybe after 15-20 minutes. But that is also not going to last for long. It's a quick fix to keep things moving while issues are sorted out. Third stage, recovery. At some point, hopefully, you have acknowledged that you have been running a marathon at a sprint pace, and decided it's time to take a step back and rest and relax. When you begin recovery, your body does its best to return your internal systems to their original and healthy levels. In order to recover, though, you have to rest, sleep, and reduce overall output, something that's incredibly difficult for entrepreneurs. This is why it's imperative that as busy as you are, you literally schedule time to rest into your daily and or weekly schedule. Make time to do nothing. Stage 4, adaptation. Now, let's say you didn't listen to your body and you decided not to make time to recover. You have chosen to adapt instead. Essentially, what you are telling your body is that this level of stress isn't going to go away anytime soon. So what does it do? It begins to settle into the feeling of constant stress and adapts accordingly, except that doesn't necessarily mean it adapts in a good way. Please note down this point. It doesn't adapt in a good way. What you will start to feel then is everything from lower energy levels to a demolished self-esteem. You won't sleep as well. You might gain or lose unhealthy amounts of weight and be far less likely to manage your emotions. The final stage is burnout. Finally, should you ignore the first 4 stages of warning, you will eventually find yourself completely and utterly burnt out. This could mean everything from full-fledged depression to actually being hospitalized with health issues. You are your most important asset. If you don't keep yourself balanced, you will suffer mentally, physically, emotionally. Remember, it is not just you, but all your near and dear. So you have to preserve yourself first in order to continue the life as it is. Don't let yourself reach burnout. you will end up spending a lot more time getting yourself back to a healthy state than just doing a little bit each day to prevent that from ever happening in the first place. So we will see certain simple techniques that we can follow or incorporate in our day-to-day practice, which can fight or counter these effects of stress. We cannot avoid stress, however, in this given life. So we have to find out certain techniques to adjust and overcome the stress. There was one question asked to Sadhguruji once. Someone asked, like, how long I should sleep? Should I sleep for 8 hours or 10 hours? Like, people say sleeping for 8 hours is good for your health, or 10 hours is even good for your health, whatever it is. The question was how long I should sleep. He said, we are buying a car to use it, not to keep it locked in our garage. So if you're going to spend half your life sleeping, then it doesn't make any sense. So if all your systems are well and good, and if you get a good quality of sleep, probably 5 to 6 hours of sleep is more than enough. That's what he said. But are we all going to get that kind of quality sleep? I doubt. So we will still go with that 7 or 8 hours sleep, but still by doing all these simple techniques or incorporating them in our day-to-day life, we probably can at least avoid the consequences of the stress and depression. Coming to the neurobiological background. The neurobiological background is mediated through the autonomic nervous system, which has 3 divisions. Usually they say only 2 divisions, but it has actually 3 divisions. The sympathetic nervous system, the parasympathetic nervous system, and the enteric nervous system. So stress responses. Our body reacts to stress physiologically. It is not just psychological. It reacts to stress physiologically. Stress responses are affected by these 2 distinct but interrelated systems. As we saw before, the SAM axis, sympathetic adrenomedullary system axis. The other one is hypothalamic pituitary adrenocortical system. We are going to see about it in detail because that is how we can understand how yoga can actually interact with these systems and cut down these stress responses. It's going to be more like a science hereafter. So the SAM axis system is component of the sympathetic division of the autonomic nervous system. So sympathetic division means it is fight or flight. Everything increases. Your heart rate goes up, your breathing rate goes up, your BP goes, everything goes up, and it prepares you in a given situation where you can react immediately and respond immediately to survive. So it releases the epinephrine hormone, it's adrenaline, from the medulla or center of the adrenal gland. Increases in circulating epinephrine facilitate rapid mobilization of metabolic resources and orchestration of fight or flight response. So now what happens? All the blood will move towards periphery. Like we get all the blood coming to our joints and bones and muscles so that they can act better. So it diverts the circulation from other internal organs, particularly abdominal organs. So that's how when SAM axis is activated, it affects your gut activity. The other axis is HPA axis system. The HPA system produces glucocorticoids, the cortisol. That is a steroid hormone. Unlike epinephrine, which does not cross the blood-brain barrier to a significant degree, the brain is a major target of GCs. I've underlined this point because from our SAM axis, we get this epinephrine, adrenaline, which doesn't reach our brain too much, but this cortisol does, this steroid hormone does. And what it will, of course, it's going to prolong your ability to combat your stress and anxiety. But on the other hand, this cortisol hormone is going to also interrupt in your brain function. So that's going to impair your cognitive abilities. Also, unlike epinephrine, Glucocorticoids production takes some time, approximately 25 minutes peak levels, and many of its impacts on the body and brain occur through the changes in gene expression. Consequently, the impacts of GCs are slower to develop and continue for longer periods, so that you can continue. Like this happens in stage 2 and 3 of the stress stages we saw. So you can continue fighting, but it will wait for you to respond positively. If you're not waiting, then it's going to give up too. So that is what happens. So due to the stresses are any situation, any stimuli that's going to cause strain to us, which you perceive as stress. So the first thing on the one side, the SAM axis, it activates the sympathetic nervous system. That activates the adrenal gland. The medulla means the inner side of the adrenal gland. Adrenal glands are the glands situated just above our kidneys, So that releases adrenaline and noradrenaline. The sympathetic nervous system itself can also release these hormones. So that prepares us for the fight or flight mechanism. It increases the heart rate, increases blood pressure, increased alertness, and increased lipolysis. It breaks down the fat and produces more energy so that your muscles are not deprived of energy for that quick response to the stimuli. On the other side, we have the HPA axis. The hypothalamus plays a very important role in balancing all these stress reactions, So when there is a stress, it activates the hypothalamus. Of course, it activates the hypothalamus to secrete this hormone CRH, corticotropin releasing hormone, which goes to the pituitary and stimulates pituitary to stimulate adrenocorticotropic hormone, which will in turn reach the adrenal gland, adrenal cortex. It is a covering upper layer of the adrenal gland to release cortisol, the main hormone, steroid hormone, which actually increases the energy compensations. It increased gluconeogenesis and increased lipogenesis. What does that mean? Once cortisol comes, it brings more energy, but it mobilizes energy from our own muscles rather than the fat. It actually improves fat accumulation and decreases your muscle mass. That is how people gain more fat with stress and anxiety. As we see, all this stress pathway is mainly through the sympathetic nervous system. How to combat, how to compensate, and how to balance. That's where this parasympathetic nervous system comes into action. The vagus nerve, we call it as the third axis, gut-brain axis. So to check the sympathetic activity, we have the parasympathetic nervous system, which is responsible for rest, relax, and digest. So what we saw before, all the circulation are diverted from our internal organs, abdominal organs, to the periphery, to the muscles, for the quick reaction. But now this is going to bring all the blood circulation to the abdomen so that it can improve the digestion. And it also is going to bring more blood to the brain and the respiratory and cardiac system so that we can rest and relax. One major nerve of parasympathetic nervous system is the vagus nerve. There is a huge scientific backup now, lots of research going on about this vagus nerve. Vagus nerve is the longest nerve in our body, starting from the brain stem and goes all the way to the gut, hence forming the gut-brain axis. It supplies almost all the visceral organs like lungs, heart, spleen, liver, gallbladder, pancreas, stomach, kidneys, small and large intestines. So that is the structure of the vagus nerve. That is the structure of the vagus nerve. You can see here, it starts from the brain stem here, start from the brain stem, it comes out, there is superior ganglion and the inferior ganglion of the vagus nerve. And then it gives the the pharyngeal and laryngeal branches. It supplies mainly the windpipe. That is very important. That's how you have to remember this. By doing Ujjayi breathing, we can influence this vagus nerve. We can tone up this vagus nerve. And then it comes down. It supplies through the cardiac branch and the pulmonary plexus. It supplies the lungs as well as the heart. And then it comes down beneath the diaphragm. And then it supplies through the esophageal plexus. It supplies the stomach, it supplies the liver, it supplies the spleen, it supplies the kidney, it supplies the colon, small intestine, large intestine, everything. So to simply remember simply what we say, heart and lungs above the diaphragm and everything below the diaphragm is supplied by the vagus nerve. But interestingly, if you notice, there are 3 cavities in our body. One is the cranial vault, cranial cavity. The other one is our chest cavity. And the third one is our abdominal cavity. This nerve connects all 3 cavities. It connects the brain to the respiratory system and cardiac system, and then to the gut. That is why this connection is called as gut-brain, brain-gut axis. So we can influence the brain through doing pranayam and other stuff. That is how the yoga uses the diaphragm and pranayam techniques in order to use our brain to produce a conducive situation where a person can go for some therapy. So influence of vagus nerve is known as increasing the vagal tone. By increasing the vagal tone, it decreases the heart rate, decreases the breath rate. Whatever happened opposite during the sympathetic stimulation, this tries to balance what happened in the initial stage of your stress attack. It increases the digestion and it improves the immune system. I'm sorry I forgot to tell about this. When there is constant activity of the other 2 axes, the SAM axis and the HPA axis, and the secretion of cortisol through the HPA axis is going to impair your immune system. When you are stressed, you will be more prone to catch infections. Please note down this. By increasing vagal tone, we can once again improve the immune system. It calms down the mind. That's very important. It calms down the mind. We have to do something to calm down the mind before you go into any behavioral therapy or any psychological counseling if needed. Functions of the vagus nerve. It's opposite to the sympathetic nervous system. Main function is rest, relax, and digest. The management and processing of the emotions work directly with the vagus nerve between the gut, heart, and the brain. The GBA that is the gut-brain axis, is like a communication superhighway between the gut and brain. We get strong gut reactions to intense mental and emotional states. That's why, when we get intense mental or emotional state, that can disturb the functioning of our colon. So important link between nutrition, psychiatric, neurological, and inflammatory diseases. Functions of vagus nerves continues. Deficiency leads, this is very important, deficiency of vagal tone can lead to brain fog, fatigue, note down, anxiety, depression, poor emotional and attentional regulation, chronic inflammation, and immune issues. So now you will understand why it is important to tone up this vagus nerve, and it is purely through yoga we can achieve this result. Critical to overall health, as it is connected to almost all organs. Like as we saw in the anatomy, it's connected to all organs. It increases the serotonin turnover. That is another very important stuff, the serotonin. Reduced serotonin levels leads to increasing depression. Actually, doctors give special serotonin preparations, that is what the main line of treatment for depression is, what they call as SSRB, selective serotonin reuptake blocker, because they want the serotonin to stay in the circulation for to relieve the depressive symptoms. So we can, without taking any medication, we can increase the serotonin turnover through all these vagus nerve toning techniques from yoga. Can alter the HPA axis and regulate mood and behavior. So that's what, when you stimulate this alternative pathway of parasympathetic nervous system, it automatically calms down the sympathetic nervous system. So it calms down, it blocks the other two axes, the SAM axis and the HPA axis. Most important link between the abdominal, thoracic, and the cranial organs. Yoga and vagus nerve. Strengthening the vagus nerve is called enhancing the vagal tone, which is studied, validated, and used widely in the medical field. VNS, vagus nerve stimulator, is used in the treatment of chronic depression and epilepsy. I don't know how many of you know. This is a device used to stimulate the vagus nerve. In case of treatment-resistant depression and epilepsy, they are using now. Pathophysiological benefits of yoga are mainly from its influence on the vagal tone, strengthening the vagus nerve. See, that is the device, They have to do 2 incisions here. So they have 2. One is the pulse generator, which is situated, which is presented here near the neck, and the other one is the vagus nerve stimulator equipment. They make a small incision on the left chest and they insert it within the skin, and the wire goes there, and the pulse generator is attached to the nerve that goes to the brain. So they say this is less invasive, easy procedure to, like the patient will be given equipment in the hand whenever they are getting depression, or sometimes whenever they are getting an epileptic attack, they have to just take that machine near their neck, so it stimulates the vagus nerve, and then they will calm down. So once they remove that machine, it's going to come back. So this is the modern science that is using this vagus nerve stimulation placement machine in order to counter chronic unresponsive depression and epilepsy. So it is really fascinating to see how we can achieve these effects without using any such invasive procedures, through our ancient wisdom of yoga therapy. Coming to the biochemical, so far we were seeing the neurobiology. Now we are going to talk about some chemistry here. So that is what I'm telling. So far, did we mention any scriptures, any philosophy? No. So yoga is, that's what yesterday I was telling to Sir's question. Yoga is a pure science. There is nothing to believe here. Everything is seen. You are doing things for a reason, which probably in between we all forget, the human beings forgot, and now we are probably reinventing whatever our ancient ancestors have done. So we are going to see the biochemical background of hormones and neurotransmitters. Hormones and neurotransmitters play an important role in the human cognitive functions. These are chemicals released by the neurons in the nervous system. Both sympathetic nervous system and parasympathetic nervous system brings about their influences through these hormones. All those effects of increasing heart rate, increasing blood pressure, increasing birth rate, everything actually they produce through releasing these hormones or neurotransmitters in the circulation. We are going to see few important hormones here. The first one, cortisol. So when cortisol is high, it's going to maintain you in anxious situation. You are going to feel fatigue. It's going to cause fatigue, inflammation, and allergies, anxiety, poor sleep, insulin resistance, and immune suppression. This is what is going to happen if you are in a chronic anxiety or stress. On the other side, when there is less, of course, cortisol is also needed in a lesser quantity. If there is going to be low cortisol, then you probably will face problems like increased fatigue and inflammation and allergies. So dopamine is called as the love hormone. Developmental problems, schizophrenia, psychosis, possible increased testosterone production when they are high. When they are low, lack of motivation, focus, memory, addictions, and cravings, low libido and increased testosterone, decreased testosterone, poor motor control, and tremors. So these two, noradrenaline and adrenaline, are those hormones secreted by the sympathetic nervous system as the first reaction for any stress. So it increases the stress and anxiety, hyperactivity, increased blood pressure, and pain. And on the other hand, when it's low, it causes lack of focus, energy, motivation, depression, and apathy. Insomnia, anxiety, stress, blood sugar imbalance, insulin resistant, and allergic reactions are created by adrenaline when it's high. And when it's low, it's going to cause poor methylation, lack of focus, lack of energy, poor blood sugar control. So there are three more hormones. Glutamate. If it is more, it's going to cause neurotoxicity. That means it's going to actually damage the brain tissue. It increases anxiety, stress, decreased mood, sleep disturbances. And when it's low, it causes low brain function, poor memory, and fatigue. See, all that means you need these hormones in a balanced amount, not high or low. Serotonin is the most important hormone here. It causes, when it's high, it causes headache, mental confusion, sweating, shivering, hypertension, tachycardia, nausea, vomiting, muscle twitching, and tremor. When it is low, that's what happens when you are stressed, right? So when it's low, it causes depression and low mood, hot flashes, sleep difficulties and anxiety, carbohydrate cravings, and constipation. The last one is GABA, gamma aminobutyric acid. That, when it's high, it causes anxiety, tingling of extremities, shortness of breath, numb feeling around the mouth, throbbing heart. When it's low, it's going to again cause anxiety, hyperactivity, premenstrual syndromes, and sleep issues, mood disturbance, or anxiety and depression. The yoga hormones, mainly we are interested in these three specific hormones, the norepinephrine, serotonin, and dopamine. So when they are alone, they have alertness, concentration, energy, the norepinephrine. But in excess, norepinephrine can cause anxiety, impulse, irritability, everything, you know. And it is also important to increase your attention. On the other hand, this dopamine, mainly when it is individually, it causes pleasure, reward, and motivation or drive. As I told you, this is called as the pleasure hormone. But it is needed to balance our appetite, sex, and aggression. The third one, the moderator, is the serotonin, which in itself causes obsessions and compulsions and increases the memory. But that balance these two, and ultimately the interaction of these three hormones brings about the mood regulation and proper cognitive function. That is why we need the hormones, at least these three hormones in balance in our body. So this is what happens when there is reduced level of serotonin. So when serotonin is reduced, automatically it causes a depressed mood. It can impair your sleep. It can overstimulate of stress hormones, which can result in anxiety. By producing depressive mood, it's going to impair everything. It's going to impair the basic relationships. It's going to impair the motivation. It's going to cause depressive thoughts. Everything is going to lead to ultimately a clinical depression. So yoga and serotonin. Serotonin is a neurotransmitter very much involved in your mood, the way you think about the world and even yourself. So it's so important. Serotonin helps with mood balance, and low levels of this important neurotransmitter can lead to depression. The there are lots of antidepressant drugs on the market, which essentially increases levels of serotonin on the brain. You can actually boost your serotonin without taking any drugs. Yes, that's right. Yoga is a natural way to increase your serotonin and helps uplift your spirits. We will see how we are going to do all this stuff. Coming to the next one, we are going to talk some physics now. So far, we were talking about biology, and then we talked about chemistry, and now we are going to talk about some physics, oxidative stress and brain damage. We all know our cells are made up of atoms. If an atom has an outer shell that is not full, like in the atom, in the outer shell, we have electrons and protons, right? So the electrons in the outer shell, they have to be paired, That's how the shell is complete. It may bond with another atom if the outer shell is not complete, It may bond with another atom using the electrons to complete its outer shell. So it takes one atom from the adjacent cell's atom, These types of atoms are known as free radicals. Which atoms? Those atoms which have incomplete electrons on their outer cells. So that what they will do, they will circulate freely in our circulation, and they will easily take an electron from other cells, So it is going to cause damage to those cells. As free radicals steal electrons wherever they can, they leave their targets corroded. Free radicals are an irreducible waste product of our own cells. Respiration. When oxygen molecules split into single atoms that have unpaired electrons, they become unstable free radicals that seek other atoms or molecules to bond to. If this continues to happen, it begins a process called oxidative stress. This stress is different than the psychological stress. This stress is the physical stress happens at each and every of our body cells. Of course, it can also include our brain cells. Oxidative stress can damage the body cells, leading to a range of diseases and causes symptoms of aging, such as wrinkles. When it damages the brain cells, that results in cognitive aging, which will in turn impede the behavioral recovery. A person, when he is suffering from such physical oxidative stress, and if a doctor is going to refer him for a behavioral therapy, do you think he will be able to combat or cooperate with the therapist? I don't think so. This is what happens, how antioxidants reduce free radicals, So the first image here that shows a free radical. So this is how it has to be. Always the electrons should be paired in the outer shell. But if for any reason, if there is an unpaired electron, that will keep on looking for another atom to bond with, So the antioxidants are those substances which we have in our body, which will have lots of free electrons in their outer shells. They will donate one electron to this free radical, and it will neutralize the free radical, so that the amount of free radical reduces, and that will reduce the oxidative stress in the physiological level. Oxidative stress and the BDNF. This is another important thing, brain-derived neurotrophic factor. This is a protein that has so many benefits to the brain. This amazing protein has been called miracle grow for the brain by doctors and researchers, because it not only supports the survival of existing neurons, but also encourages the growth and differentiation of new ones as well. The BDNF helps the parts of your brain that control critical functions like memory, emotion, and executive function. So it's very important to have adequate BDNF in your brain for your brain to function properly. Higher levels of BDNF have been associated with a lower risk of dementia and even depression. Sorry. The cytotoxic free radicals can affect the BDNF levels causing decline in the brain function. See, this is what happens due to the oxidative stress to our brain. So this is what happens. So the cytotoxicity, because of the oxidative stress, it actually degrades the membrane phospholipids, releases of superoxide, peroxides, and free radicals. That actually causes cumulative oxidative stress, which will decrease the BDNF levels in our brain. When the BDNF level reduces, it reduces the synapsin and the CREB. Don't worry about the CREB. It is adenosine monophosphate levels, So that when that reduces, it causes synaptic dysfunction and cognitive impairment. So it is very important to have this BDNF adequate in our brain. Oxidative stress, BDNF, and yoga. Antioxidants are the weapon of choice. So they are the molecules that fight the free radicals. They neutralize the free radicals. Antioxidants soak up free radicals like sponges, so soaking up dirty water. Regular yoga training can decrease free radical formation and increases the antioxidant system. And yoga should be considered one of the therapeutic methods for relieving stress and overall well-being of the brain and body. Yoga has been shown to actually boost the BDNF factor. So these are all research-based, So they have researched and found all these facts behind using yoga as an alternative system to combat all these stress. Effects of yoga on gray matter. Now we are coming to look into the anatomical background. Gray matter is a major, I'm sorry if I am boring, I need to explain all these background before going into the actual techniques. That's how you will understand why we are doing this stuff, so that your compliance might be better in doing yoga. Gray matter is a major component of our central nervous system that is involved in memory and speech. We all lose some gray matter volume as we age. This is an unfortunate truth, but it's not inevitable. Sometimes if you commit some mistake, your superior might ask, do you have enough gray matter? So that is how the gray matter is so important for our cognitive function. Studies have identified differences in gray matter volume between long-term mindfulness practitioners and control. Yoga meditation practitioners exhibit greater gray matter volume and fewer reported cognitive failures. Slowly my anxiety level is down now. I'm getting used to. Recently, a study looked specifically at yoga and found that controls, that is a control group in the study, displayed the well-documented age-related gray matter decline. With age, we all lose gray matter, while yogis did not, suggesting that yoga contributes to protect the brain against age-related decline. How amazing is that? We can reduce. See, one increased threat with the aging population is the Alzheimer's disease and the dementia. That is what most of the Western countries are suffering mostly from. So this, you forget who you are. That is a very worst thing to happen to any human being. It's okay to be dependent, but you have to be conscious about yourself, right? You lose your consciousness in dementia and Alzheimer's, which is really pathetic. So that is what we can prevent by doing yoga. The last one is the most important muscle, one of the most important muscle in our body, the iliopsoas. It's called as muscle of the soul, iliopsoas. It's important muscle connecting the spine to the lower limb. It is connected to the diaphragm too. That is what we all miss. This is the iliopsoas. It's actually three muscles. Iliacus, this is the ilium, our pelvic bone, and this is the psoas major and minor muscles. So they all combine like as a tendon come down and they attach to our thigh bone femur here, So that is a very important connection. It is called as, its main function is hip flexion. When I'm sitting like this, my psoas muscle, iliopsoas, is shortened. That is what happens when you are constantly sitting in front of computers, working in computers. And now at home, no work, people, even those who have active jobs, now sitting at home, doing nothing, sitting in front of TV, sitting for a long time shortens this iliopsoas muscle. Prolonged sitting, stress, anxiety, poor posture can cause dysfunctional psoas muscle. And a dysfunctional psoas muscle also can contribute to stress, anxiety, and poor posture because it is attached to the diaphragm. So when it is attached to the diaphragm, it's going to disturb the function of the diaphragm. And through vagus nerve, this diaphragm and the iliopsoas can influence the brain and cause more stress. Therapeutic approaches. There are several therapeutic interventions available in the management of stress, anxiety disorders, and depression. There are several modern therapies available nowadays which are proven very effective and are evidence-based. Importantly, the cognitive behavioral therapy and psychoanalytic therapy play a vital role in the management of such psychological issues. Psychoanalytic therapy. In psychoanalytic therapy, looks at how the unconscious mind influences thoughts and behaviors. It's important that psychoanalytic therapy speaks about unconscious mind. Psychoanalysis frequently involves looking at early childhood experiences in order to discover how these events have shaped the individual and how they contribute to current actions. Psychoanalytic therapy also makes use of other techniques, including free association, exploration of transference, observing differences, and feelings patients may not be aware of, as well as dream interpretation. They are trying to use all these feelings of unconscious mind as well as conscious mind as a therapy. On the other hand, we have the CBT. It's all about more than identifying thought patterns. It is focused on using a wide range of strategies to help people overcome these thoughts. Such strategies may include journaling, role-playing, relaxation techniques, and mental distractions. It's mainly based on the vicious cycle of our thoughts, perception, and behavior. That is the cycle, the ABC model of cognitive behavioral therapy. So it all depends upon the event. The events could be the world, other people, personal experiences, personal history, future self, whatever we are looking into. Right now, we are looking into the world like with no clue. Particularly, I think for Chennai people right now, there is no clue when their lockdown is going to be released. So next comes the thought. The thought is a person's individual thing. The attitudes, rules, demands, beliefs, images, meanings with the previous experiences. That processes with the emotions, the healthy feelings, unhealthy feelings. The thought is influenced by these two feelings, the emotions, the physical sensations, and the interaction between these three decides the behavior, whether a constructive action or a self-defeating action, whatever it is. The interaction between the ABC is the main thing. So what they say, they ask their patients to analyze their thought, sit and read your thought, and then they discuss whether their thoughts are right or wrong. If they have a wrong thought, then they try to intervene and try to correct the thought. That is the main background of this cognitive behavioral. There are other tools as well, but this is the main basic of the model. So what happens? I believe like in the cognitive behavioral therapy, they don't speak anything about the subconscious mind. As I told you before, when a person's SAM axis, HPA axis, everything is activated, do you think he will be able to sit and read his thoughts? I don't think so. They cannot do that. The person will not cooperate. So I believe that the psychologists and therapists would agree with me if I mention that it's not an easy task to get the person actively involved in the process at least in the starting stage. We have to create a level playing ground which is conducive so that a person can sit down and read their thought and analyze their thoughts. Otherwise, he's not going to cooperate. Critics who claim that psychoanalytic therapy is too time-consuming, expensive, and generally ineffective. Some, such as Noam Chomsky and Karl Popper, suggested that psychoanalysis lacked a scientific basis. Cognitive behavioral therapy doesn't tend to focus on underlying unconscious resistances. This is what is the flip side of cognitive behavioral therapy. Becoming aware of these thoughts does not make it easy to alter them. Of course, I know that I've got a wrong thought, but is that easy for me to listen to a therapist and change my thought process? That is questionable. The individual must be ready and willing to spend time and effort analyzing their thoughts and feelings and finally willing to change. I have lots of patients, who go for this counseling and behavioral therapy. When they come back during my next physio session, I ask them, how was that? Everyone, mostly almost 60 to 70% people say, yeah, I just went and spoke. We keep on speaking. That is the reaction we get. That means they're not actively involving themselves into the therapy. So how beneficial that therapy is going to be for them if they are not actively involved? So that's where the need comes for the therapy integration. Integrating yoga therapy into the behavioral model could help to bridge the gaps and produce a situation which is conducive for the individual to become more involving and motivated. This effect is achieved by connecting the behavioral cycles with the yoga therapy tools through the strong organic connection, which is the breath, brain, and gut. Breath has proven as a very strong mediator in influencing the brain and connecting the behavior therapy cycles with yoga meditation cycle. And that connection is based on the neurobiological, neurophysical, neurochemical, and neuropathophysiological foundation. Nothing, of course, all these techniques are taught by our ancient sages and gurus, and they are refined and refined and refined by many modern gurus. But they all have this much of scientific backup. Yes, we are going to utilize all these processes that we saw so far in building this model. So these are the cycles, In the behavioral therapy model on the left side, you have the core beliefs which influences your thoughts, feelings, and behaviors, which will in turn influence your rules and assumptions. So they make a person sit and analyze their thoughts, and then they try to relate between the core beliefs of the person and the rules and assumptions. That can be a false assumption, which they will try to correct. Everything happens in your conscious brain level. On the other hand, the yoga cycles, they have the breath, body, and mind. Yoga believes that there's a strong connection between mind, body, and breath. You can influence your mind through breath or body. So if you incorporate all three, you can influence and treat your bodily symptoms by influencing it through your breath and mind. You can treat your mind by connecting the breath and body. That's what yoga cycles are. So the gut-brain axis and therapeutic interventions. This is where the gut-brain axis comes into play. We have the cranium. As I told you before, there are three cavities: the cranial cavity, the chest cavity, and the abdominal cavity. It should be like abdominopelvic cavity because it also involves mainly the pelvic organs as well as the iliopsoas muscle. So in the cranium, we have the brain. The chest, we have the respiratory system, the lungs, and the abdomen, we mainly have gut. We can influence the brain through our gut or through modifying the breath. This is a scientific intervention which our yoga and yoga instructors, yoga gurus have been using from the time unknown, So they knew probably these signs. GBA link to therapy, the gut-brain axis link to therapy, link between organs of three cavities. it mainly linked through the vagus nerve. So whatever we are going to do, majority is going to be influencing the vagus nerve. Psoas muscle, psoas, the muscle of the soul, as we saw, we have to manage. It's chronically tight, particularly now as you are sitting for a long time. When you sit, the psoas muscle is shrinking, so it causes tightness in the psoas muscle, which is going to impact the function of the diaphragm, and that's going to affect the brain function, the cognitive function. If we have a functional gut, that will produce a relaxed breath, and that will calm down the brain. So that will bring about a clarity in the mind, which will be conducive for any therapy. So what happens, the ultimate result is there is no fear, you can win anxiety, and there is nil depression. So these are the cycles, how we influence. There is behavioral therapy cycle, definitely where we need those behavioral therapy cycles, like as we see ABC. And on the other hand, we have yoga cycles, that is the breath, body, and mind. These two we can connect through the GB axis. It's beautifully connected, and it is neurobiologically back up so that we can influence. So if you have any bodily symptoms, any gut symptoms, you can relieve it through influencing the vagus nerve through proper breathing exercises or proper pranayama. On the other hand, by having proper gut function, we can influence even our brain, so that there is a conducive situation where a person will be interested in modifying their thought process and becoming more active and interactive in their therapy sessions. Coming to the yoga integrated behavioral therapy techniques, that is, mostly they are exhale based asanas. Remember, when you do exhalation, so we are going to do exhale, hold, or prolonged exhalation. That actually improves the stimulation of the vagus nerve, and it also causes more rest and relaxation. That means it activates the parasympathetic nervous system. So whenever you constrict, whenever you contract, whenever you bend forward, or whenever you shrink, you have to exhale. Whenever you open up, like in certain this thing like Virabhadrasana, or in case of Dhanurasana, so all those asanas, we are opening up our chest. So we are doing them in an inhale position. But these postures which actually constricts, they are using exhale. So we call them as exhale based asanas or postures. Examples are forward bend postures like Tadasana. You always better start with Tadasana. In our tradition, at least, in Krishnamacharya Yoga Mantram, we mostly start with whichever position you start, like in sitting or standing, But if you are standing, we start with Tadasana. Uttanasana. Uttanasana is this first figure here, bending forward, sitting straight up, breathing in and breathing. As you exhale, you're going to bend forward and breathe out. Like I will just explain to you this Uttanasana in standing, this second figure here. So standing, you're going to have your hands on your side. So as you inhale, both your arms goes up, and as you exhale, you are going to bend forward, and come achieve this position. So then again, you can stay there, take a couple breaths if you can, and then come up as you inhale, and then as you exhale, drop your hands down. But you go to the posture when you are exhaling. So that is the posture. These are the postures which uses exhale to reach to the main posture. Prasharita Pada Uttanasana is this one, this third one. And then Paschimottanasana is sitting in forward bend. Sharvangasana also. So it's important to understand Langana. Langana means mostly relaxing postures, Relaxing postures help to relax your brain and body. Asanas to stretch the psoas muscle. Hope you all remember the psoas muscle that connects the lumbar spine with the thigh bone. So these are simple stretching and asana poses to stretch. So that is a modified cobra here down the last figure here. This is the Gopal Tapidam, like the pigeon's stretch. And these two are important stretches. You can lie down on a couch or a bed, like your bottom touches the edge of the bed, and you can leave the one leg down hanging while you bend, fold, and hold the other knee towards your chest. In that way, you are stretching the iliopsoas of this hanging leg. This is another important stretching posture, the first one for the iliopsoas muscle. But here you have to kneel down. If you have any knee issues, probably this is not going to be something that you're going to enjoy doing. You can do either this way, lying on a couch, or you can do this modified cobra where you lie on your stomach and raise your head and neck up along with your chest with your hand support. So these are all the stretch poses. See, I'm just giving examples. There are many other poses that you can use for all these this thing. So it's, if you know any poses you can use. The concept is you have to stretch your iliopsoas. Okay, in the first thing here, the concept is concentrate doing more exhale based postures. But here all these postures are actually inhale based poses. Like, so you're going to inhale doing, if you want to stretch your psoas muscle, you have to do inhale based poses more. And if you want to relax your mind and calm down, you are using more of exhale based asana. But see, it's always advisable to see a competent yoga therapist who can build up a course plan for you based on your individual requirement. Yoga therapy is never a group session. It has to be one single goal-oriented group session if needed, and that group has to be a very small in number so that there is more attention. Otherwise, if you have any specific goals, it's always to go with one-on-one yoga sessions. Next is pranayama. That's interesting. So the main thing in pranayama, when you are trying to relax your body and mind, you're going to use all the pranayama which are going to be relaxing and calming down, and those which actually stimulates the vagus nerve. The first one is the Chandravedana pranayama. Hope you all know. Chandravedana pranayama is mainly using your left nostril for breathing in and out. Sitali pranayama, this is another important pranayama. They have done a biochemical analysis of our saliva before and after doing the Sitali pranayama, which has shown increase in the biochemical content of the saliva, particularly human growth hormone and the serotonin. This pranayama is important in maintaining our brain health. Next comes the Ujjayi pranayama. Ujjayi pranayama, once again, as I told, as we saw the connection of the vagus nerve. The vagus nerve also connects the windpipe. So by doing Ujjayi pranayama, we are actually stimulating the windpipe, particularly the larynx and the pharynx. That will in turn relax the brain and causes a conducive situation for the cognitive function. Exhale and exhale hold. So always practice exhale, like concentrate on exhale. I don't say that you have to just do exhale, which is not possible, but you have to concentrate mainly on exhale and exhale hold if your goal is to relax your mind. The Brahmari pranayama, that is more important, like what we demonstrated yesterday. Brahmari pranayama also has a huge impact on relaxing our brain. Nadi Shodhana is the most important pranayama here because it directly acts on the autonomic nervous system. It influences what is called as Vada and Ida Kalai. It is nothing but Irakalai and Pinkalai. It is nothing but the two main branches of autonomic nervous system, the sympathetic nervous system and the parasympathetic nervous system. The Nadi Shodhana is believed to bring a balance between these two systems of the autonomic nervous system, which will in turn produce calmness, quietness in the mind. Mantra chanting, once again, Om chanting. There is a huge scientific foundations for chanting Om. What we are using is not the actual Om. Once again, it is a sound of Ma. Like if you don't want to do Om, you can just simply, when you are exhaling, you can chant Ma. That Ma sound actually causes relaxation in the brain. And if you're not against it, you can chant Om Somaya Namaha. Somaya is none other than the moon. The moon is said to be relaxing, right? Compared to sun, it is a relaxing energy. So we are inviting a relaxing energy in the form of the moon. So increasing the concentration. Of course, people use auto suggestions and all of other stuff in order to improve our cognitive function through mantra chanting. There are lots of, people advise several mantras and kirtans and lots of chanting. People can, they are suggested in the scriptures, and of course, there are lots of scientific research going on nowadays. The scientific impact of those scriptural mantras, and the results are really enhancing and encouraging. If you are inclined, you are welcome, but those mantras, they say you have to learn from a competent teacher. And the bhavana, visualization, visualization, of course, we are going to see once you do all those vagal nerve tone improving exercises, you can visualize as if, like a calm and peaceful, serene atmosphere. You can visualize the moon, you can visualize a calm waterfall or a calm river, all those stuff you can visualize in order to relax your brain. So these are stuff I'm not discussing much because probably most of the yoga therapists will be able to help you out with all these tools. Now comes the most important vagus nerve stimulation. So when you are stressed, we have to stimulate the vagus nerve. The idea is to increase the vagal tone, right? The first and foremost thing is acute cold exposure. Splash cold water on face. Wash your face with cold water. You see an immediate change. Or go have a cold shower. Of course, it's still doable in countries like India, but not in countries like Canada, where I'm living now. We cannot have this cold. But of course, we can expose ourselves to snow, so that actually stimulates the vagus nerve. Or drink cold water. That's going to help. Next is humming. This is where the Brahmari Pranayam comes into play. Brahmari Pranayam actually stimulates the vagus nerve because of its humming quality. So chanting Om Ma increases, they have found that it increases the heart rate variability, An important benefit of these pranayams are the important benefit of this pranayama is they normalize an irregular heart rate. So having positive social relationships, thinking compassionate about others. See, this is what we all are lacking now. Thinking compassionate about others. We are always self-centered. We have to think out and think about others who are in trouble and try go help. Positive emotions like serenity, joy, and hope, and meditation. I think someone have to mute your listening so that everyone can listen. So the pranayama, deep breathing exercises, breath hold, ujjayi pranayama, and here comes the kapalbhati. Why kapalbhati? Kapalbhati actually improves your abdominal tone. It massages the organs of the abdomen, mainly the gut, so that improves the circulation to the gut. When the circulation to the gut improves, it automatically influences, stimulates the vagus nerve. So the meditation, breathing based meditation. So what you're going to do in meditation, there are lots of meditation, but meditation techniques taught by different schools of thought in yoga and meditation. There are mindfulness, everything. But a very simple meditation is what we did yesterday, the breath observation. Just observe your breath. Once you start observing your breath, automatically you will tend to close your ears and you internalize. Meditation is nothing but you are internalizing yourself, and you concentrate. Maybe you can bring your concentration between your eyebrows and then try to concentrate how you breathe in and breathe out. You can follow your breath from your nostril to the lungs and then come back from your lungs to the nostril, and gradually you can increase the time of your breathe in, inhale and exhale, as we saw yesterday with the numbers. Okay, so the next important thing is the massage, especially feet and neck along the carotid sinuses and abdominal. See, very important. Many times we miss when we have abdominal problem. We try to go have antacids and other stuff. We try to have like soda and other these beverages, to support your abdomen. Just take your hands and massage your abdomen. Massage your abdomen. If you can have some hot compress, like hot water fermentation of your abdomen. And in naturopathy, what we do, we apply mud packs on the abdomen. So why mud? Mud is nothing but earth. Earth makes you more grounded. When you are grounded, you are making a connection between your body and the earth, which makes you grounded. When you're grounded, your cognitive function increases, your vagal nerve tone increases too. So you can apply mud. What you can do, simply take mud, like, near your house, wherever it shouldn't be a mud from elsewhere. It has to be mud that is taken near from your wherever you are living. So just take mud, like mix with water, make it as a paste, and you can cover it with a thin towel or a cloth, and as a wet mud, just apply it on your abdomen and lie down, relax, and you can concentrate doing meditation or pranayama in lying with the mud packs on your abdomen. That actually makes you more grounded. And the abdominal massage, massage when you have these psychological symptoms, massage your abdomen. That's going to improve the circulation in the abdomen. What do that mean? If the circulation in your abdominal organs increases, that means the circulation, the sympathetic nervous system is being shut down. So that's going to redirect the blood circulation to your abdomen rather than to your periphery, like what the sympathetic nervous system does. So other important thing is the ear. You have to, actually I have to demonstrate this. Just one demonstration, right? After a long time. Okay. Hope people are still enjoying the session. I'm sorry for being too much of informations, but I think that is going to help us to understand the background. So with the massages, first thing is the abdominal massage. Have your hands. See, your hands has the healing powers. Have your hands and massage your abdomen. That's going to improve blood circulation. That's one thing. Second thing, the vagus nerve supplies this area. Like it supplies the ear and the neck skin around there. So you can massage your neck. And important, you're going to massage, like take one hand here, massage this muscle of trapezius. Massage the muscle of trapezius. Massage your muscles. You're going to do on your own. If you have a wife or husband, you can definitely make use of them. Massage your trapezius. See, three muscles which are important. One is the sternocleidomastoid, which is here, which connects our clavicle and sternum to the mastoid process here. So you're going to massage, all hope you are able to see. You're going to massage all these muscles there, and then you are going to massage this trapezius that goes all the way to the neck. Massage the base of the base of the skull. All those muscles. That's where the trapezius muscle is getting attached. Massage them, and then you have these levator scapulae. Like, keep massaging them. So what you are trying to achieve, you are trying to increase the vagal tone. Don't think that you are just massaging. So that is where massages are traditionally followed by our people long time with the Ayurvedic practitioners. So the next important technique is the ear lobes. What are you going to do? You're going to hold your ears like that. Please observe what I'm doing. So you're going to hold and pull your ears up like that. What happens to me when I do that? When you pull up, it increases. Like, you tend to take a deep breath. That much influence this simple technique. This is so simple that you can do. You can try these techniques even in a panic attack, like just. So you're going to pull your ear lobes, and then pull up. It makes me to take a deep breath. Try that, it makes an enormous impact on our psyche, So even massaging here, that is where, like, if you remember the vagus nerve stimulator, they are implanting there, the stimulator, right? By stimulating them, you are going to actually increase the vagal tone. The other important stuff here is your posture. These muscles, when the sternocleidomastoid and trapezius are tight, you develop a posture, what is called as forward head posture. We are always like that. Either you are typing, you are driving, you are cooking, you are washing your dishes. We are always like sitting like that with a forward head posture that brings our chest forward too. When we are sitting like that with a hunchback, that actually brings your head forward. That's going to disturb not only the vagal nerve, but all the nerves that comes from the brain stem. So another important muscle to be stretched is the suboccipital extensors, which are situated here. What you're going to do, I'm going to demonstrate from the side. What you're going to do, you're going to stand or sit straight, have your shoulders on your side, and then you are simply going to retract your chin back. Your eyes looking level. You are not going to look down. If you look down, you will do this. You will tend to bend your head forward. Don't do that. You're going to look your eyes level so that, and you're going to retract your chin back. Many people, when they do this, they also try to round their shoulders. No, the shoulders have to be on the side and retract your chin. Simply doing this actually elongates your spine. Simply tucking your chin, chin tuck exercises. Once you start doing this, it releases the vagus nerve from the entanglement because of the poor posture. At the other end, the chin tucks. Yeah, wait for the questions. Yeah. The other thing is the chin tuck. Also, you have to maintain chin tuck whatever exercise you do. I've seen many people doing biceps curls with forward, bending forward and doing biceps curls. They are going to use all the muscles, So even for doing biceps curls, if you hold your chin tuck and do your biceps, then you are isolating the muscle so that the effect will be better. So those stuff you're going to do. The other one, there is another one more technique to release the vagus nerve, improve the vagal nerve tone. What they say, you're going to sit you're going to clasp your fingers, have your hands like that, either you lie down in that position or sit down in that position. That's a relaxed position. And you're going to bring your eyes to 3 o'clock position, like in a clock. If you see 3 o'clock is looking like that, I'm going to just look like that and just concentrate there. I'm just going to wait. I will do that when I'm stressed out or I'm anxious. I'm just going to lie down. It has to be lying down. Or if you are coming to sit down, if you're sitting in a couch or in a car seat, you can just, before starting to drive, you can try that. Just relax and move your eyeball to the 3 o'clock position and stay there until you feel like swallowing, or until you get a deep breath, or until you get a sigh. That notices that your vagus nerve is getting balanced there. And then you can start combining, continuing whatever you are doing, just few minutes, like maybe maximum 2 to 3 minutes. If you're stressed out, you can try that, So with that, let's go on to our presentation back here. Of course, laughter, gargling, with hot water gargling or whatever you are doing, we are trying to actually stimulate the vagus nerve by stimulating our larynx and pharynx. Nada yoga. This is another very important, interesting thing. Okay. That's a huge science. It's a sister science of yoga, the Nada yoga. I'm not going to go in depth of that science because it's a separate presentation. But I'm going to say how you can use this Nada yoga for anxiety and any disease. Any disease, even if it is a fever, you can still use this Nada yoga. The idea is, of course, we know we breathe through both nostrils, but the breath doesn't happen in both nostrils every time. If you can check, just have a finger and check. Of course, the air will be blowing on both your nostrils, but one nostril you will feel more warmth compared to the other nostril. That means that nostril is predominant in that given time. Like, okay, I am feeling tired, frustrated, So just have one finger like that and breathe out. If, for example, now I am feeling more air coming through my left nostril, So if you are suffering from any ailment, you can simply switch the passage of air to the opposite nostril. What you're going to do? Very simple. In the ancient days, if you see our gurus and those munis and sages, they will be sitting with that danda, That danda, they are not using simply holding the danda. They use the danda to switch this nada, the breath, So there are certain activities we can do, like, it's a huge science. Like, there are certain activities that you can do when your breath is flowing through your right, and there are certain activities that you can do when the breath is flowing through your left. You can also influence your concentration by getting direction to the nada. I'm not going into all those subjects now. What you can do simply, if you feel anxious or any disease condition, simply check which side you are breathing. If you think that you are breathing more through left side, simply block that nose and continue breathing on your other side. Like within few minutes, you will see that there is more airflow happening in the other side. The other way you can do is, if you want to switch from left to right side, you can simply lie down on your left side. Whichever side you want to switch, have that side higher. So you're going to lie on your left side. Within few minutes, you will see that there is more air moving through your right nostril. So what it does, so this calms down, it actually activates, increases the vagal tone, and it balances the autonomic nervous system and brings about, it shuts down the sympathetic nervous system and reduces your anxiety and other symptoms. You can see in according to behavioral therapy, it's hard for someone to sit and analyze your thoughts when you are in a panic attack, right? But you can definitely do these stuff in order to influence your brain, So you can do all these techniques, particularly the Nada Yoga, which has got, like, we even use this Nada Yoga through the cycle of Amavasya and Paurnami, the days. There is a measurement in which nostril it should start when early in the morning, So that's a different science. Probably I will try to do that in maybe in our next opportunity. So the next is Yoga Nidra. This is another important thing. That is where the Jacobson's relaxation techniques came from, Yoga Nidra is something that we follow traditionally. So you are going to lie down in Shavasana, you're going to lie down with a comfortable position. But the importance here is any asana, you have to be comfortable. At the same time, you have to be 100% aware of your situation. You are not going to sleep in that position. If you're going to sleep, then that is no more Yoga Nidra. Whenever yoga comes, there comes increased awareness. So in that position, you are going to tighten each and every part of your body and relax. It's a cyclical procedure. That itself is minimum half an hour to 40 minutes long demonstration, which probably you can learn from any yoga therapist for that matter. Managing intense stress, anxiety, and suicidal thoughts. Huge topic to be discussed in a separate session, but I would like to address this because of the increasing suicidal thoughts that the youngsters are getting. Manage your fear. You have to manage. See, fear is something that's going to be there. It's never going to go. You have to analyze your fear. Why this fear is coming? As I told in the beginning, the fear comes from the impending need for change. We all know that we all are in a situation, uncertain situation, but we also should know that we have to grow out of this pandemic. We have to evolve as a more empowered, more resilient, and well-evolved new human beings. Probably that's how I see this coronavirus situation. This probably is going to refine and going to produce better human beings, maybe. And there is Osho Sankalpa meditation. This is one thing I would like to share. Of course, there are a lot of meditative techniques that you can follow, but this one, if someone has a suicidal thoughts, you can teach this one for them. What he says, if you want to achieve some goals, what he says is, it's particularly he wants this everyone to practice before and after sleep. Before sleeping, what he wants you to do is, let me demonstrate. So the next two things are, I will demonstrate that. Avoid being alone, listen to music, satsanga, that's what we call it as. You can go to satsanga where you can listen to like whatever religion you feel, like it is a Christianity and Islam or whatever. Go to those religious associations where you can listen to those scriptures which might calm down your brain, and attend prayers. So what he wants to do, the yoga meditation Sankalpa Yoga, he wants to breathe out. Breathe out. Never take a breath in. Wait, breathe out. Further breathe out. Further breathe out. Keep breathing out, breathing out, breathing out without taking a breath in. Keep counting. It's unable to count, but never take a breath in continuously until every cell of your body is struggling for oxygen. Keep breathing out, breathing out, breathing out. So every cell in your body is struggling to get the next breath in because of the oxygen continues. So in that stage, suggest your brain that I have to live through this pandemic. I have to live. I am not dying out of any such external atmosphere. I will win and I will come out successful. Keep suggesting, telling that auto suggestion when your entire body, every cell of your body is struggling for gas, oxygen, then that suggestion gets registered in every single cell of your body, so that if that helps to change your mind of suicidal thoughts, So of course, this technique, please don't try if you have any existing breathing difficulty, This is mainly I'm suggesting, of course, he advised for every good activity or every good habit, he wants us to try this, so you can register that in your brain and every cell of, for example, simple, like if you want to get up early in the morning, like 5 o'clock every day without setting an alarm, before sleeping, do this. Block, exhale, 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 and suggest every cell of your body, you should get up by 5 a.m. in the morning, train and do. He suggests, Osho, Rajneesh Swami has suggested this kind of meditation. I think we can use that for balancing, counteracting the suicidal thoughts. There was an interesting Dalai Lama when asked what surprised him most about humanity, answered, man, because he sacrifices his health in order to make money. Then he sacrifices money to recuperate his health. And then he's so anxious about the future that he does not enjoy the present. That's what we are thinking, we are doing now. We all are thinking that what's going to happen? When is this pandemic is going to happen? It's closed down. When is this lockdown is going to release? When am I going to go back working? No, stop. Enjoy your time with your family. Like you haven't enjoyed, if you are 40 years, you haven't enjoyed all this time. Now take this time, maybe another month, another 2 months, take this time to enjoy with the most important people in your life. The result being that he does not live in the present or the future. The last line is the one which is amazing. He lives as if he is never going to die, and then dies having never really lived. Isn't that amazing? Amazing wisdom from an amazing person. So we have to live this life in the presence. This is what is the situation. I also would like to, before giving the thanks, I also would like to have these words of Mahakavi Bharati, Achamillai, Achamillai, Achamenvadillaye, Uchimidu Vanidindu Virindra Podilum, Achamillai, Achamillai, Achamenvadillaye. So what we are facing now, the pandemic, is no bigger than the whole sky is crashing on our body or brain head, So never think this is the end. This is possibly going to be a new beginning in the history of human being. A big thanks to one and all for bearing with me all this time. Thank you so much for the organizers and all our professors. We can open the session for questions, I guess, if there is time. Are there any questions?
Dr. Nirmala, madam.
Thank you.
I think
all this thanking.
Your questions are there in the chat box.
Yeah, I'm just looking.
Yeah.
It's moving so fastly, so I couldn't grasp.
You can just stop one or two things which is interesting, which is related to the today's topic. You can just answer.
Managing repetitive thoughts. See, that is what. See, before even analyzing the thoughts, you have to see. That's what all this fear, anger, everything, comes from, that's what yoga philosophy says. It all comes from an impure ground, So you have to clear the ground in which better seeds can give better plants, So before thinking about the seeds and the tree, we have to do our homework, clearing all the brain fogs and stuff so that our cognition is better, at least even to analyze our thought process so that we can process it. Repeat the breathing exercises to get deep sleep. Okay. Oh, I don't think we have enough time. Any more questions? Which yoga is best for fat loss? Yeah, see, weight gain, if it is due to this anxiety and psychological problem, definitely you can influence. See, of course, there are exercises, go for walking, aerobic exercise, everything helps. But if you have a poor vagal tone, whatever exercise you do, it's not going to help you. So you have to improve your vagal tone so that whatever exercise you do is going to help you in actually improving your weight loss.
Yes, Dr. Sendil, I will read the next question. It has come in the chat box. Is there any most suitable time to perform yoga for a day? Can we perform at any time, like morning, evening, noon, etc.?
See, the therapeutic yoga you can do anytime. Before food, before sleep, after sleep, morning, afternoon, evening, it is therapy. When you are doing yoga for higher goals, there are set rules to do. Like it has to be in the morning, it has to be in the empty stomach. All those rules comes only when your goals are higher. But when your goals are like trying to come out of a panic attack, or when your goals are trying to come out of an anxiety attack, you cannot wait for an empty stomach. You have to do right there, right? So these therapeutic yoga we can do anytime. There is no time limit. But when you are doing yoga for other higher this thing, as you see with yoga, what happens, it self purifies your thought slowly. Like, if for example someone is asking, I want to stop smoking, can yoga help? Don't do like that. Just start yoga. Yoga is simply elevating your health. It's going to take you from down and gradually it's going to build, take you slowly to a higher stages of health status. Automatically it reduces the urge to do all those bad habits. So if you're just going to ask me, can I do some yoga to stop smoking, then it's not going to happen. Start doing yoga and all those extra benefits are going to join. You're going to gain all those stuff in the way of doing yoga.
Okay. Thank you. The
Can
next
you
question is, yes, sir, Professor Ilango, sir.
There is one question, like should we do yoga before pranayam? Traditionally, yes, you have to do yoga asanas before. See, that is how, like yaman. See, the other thing, if you want to achieve all the benefits of yoga, then you have to follow the Ashtanga yoga. Yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, and then samadhi. So you just doing all the nonsense, all the ill behavior, having all the ill behavior, and if you're continuing to do your yoga and pranayama, is that going to prove effective? I don't think so. You also have to refine the yamas, rules and regulations that you have to follow in your personal life and in your societal life.
Okay. Professor Ilango, sir, you want to say something, sir?
Yes, ma'am. Thank you so much, ma'am. Thank you very much, Dr. Sendil Raja,
Yes, sir.
for that wonderful presentation again. Today, I enjoyed it more than yesterday because you brought in a lot of science. I think
Yeah.
you brought in the biology, the chemistry of it, and
Everything
then the
science.
physical aspects. Everything is science. Yeah, that is something which is amazing, sir. Thank you so much. I just have one small point. If you could kindly clarify, that thought was running through my mind as you were
Yes.
making a presentation of all the scientific aspects of yoga. It was fascinating. But I was just wondering, as a physiotherapist yourself, and as a yogi on the other hand, as a person who practices yoga and professes yoga to others, recommends yoga to others, I wanted to know what is the connection between physiotherapy and yoga. No, the point that I'm trying to make is, as a pure physiotherapist, there are a lot of people who are doing physiotherapy alone without, getting into yoga. And there are a lot of people, there are maybe a few people like you who are doing
I think this call is getting disturbed. So his main question is, in what way interacting or incorporating yoga helps in physiotherapy? Definitely, yoga is the main goal of yoga is to elevate your well-being. So if you want a better, so if I want relieve my back pain, of course people come to us for physiotherapy. In the starting stage we do physiotherapy and then it relieves the back pain, but is that going to come back? Definitely yes, it's going to come back as long as you don't do the follow-up exercises. But as the follow-up exercises, instead of doing general exercises, if you do yoga therapy, then the results are going to be better. So that yoga comes as an additional specialization for a physiotherapist. If a physiotherapist has a background in yoga, that's going to help us. For example, I had the opportunity to learn yoga from our great Krishnamacharya Yoga Mantram. That's a more clinical yoga therapy. In fact, I had my visa. I had to come here to Canada before even completing my course. I had to cross the borders, right? So I came and I went back within a month, and then I completed the course, and then only I came back because I did not want to lose that knowledge. But that is helping me a lot in my day-to-day practice as a physiotherapist. Hope I answered your question, sir. Thank you so much. Any more questions?
Yes, sir. Thank you so much, sir. Thank you, sir. Thank you.
Okay, so thank you.
బాగుంటుంది.
We are nearing 12 o'clock. Already it is 12 o'clock. So some of the questions are there in the chat box. It will be replied to your email later. So now we can move on to the concluding session. So now I request my head of the department, Professor R. Mangleshwaran, to give the concluding remarks of this session. Welcome, sir.
So thank you, madam. Thank you, Dr. Sendil Kumara Raja. That was a really enlightening session, right? So it is the gift of God, right? Which our India, as an Indian, we should be proud, as you said. So maybe 5,000 to 10,000 years back, we had this gift from India, from the Patanjali, Swami Vivekananda, T. Krishnamacharya, Sivananda. So all these people, we are indebted to them because even in those days, about the time immemorial or 10 years back, they were able to give an evidence-based yogic practice. So that was the thing. And as an Indian citizen, we should be proud that the gift that is being taken from India to the other, it has percolated to the different parts of our country. So thank you, sir. And in fact, that was a really evidence-based, more scientific thing which you have made it. Because you started with a very a scientific way of explaining the public health emergencies. What are the real public health emergencies? The root cause of mental health problems. The fears, because now as you said, the fear, sense of uncertainty is there, prevailing, all over the world because of the pandemic situation, and how we are going to overcome this anxiety, frustration, and depression. And you have really made different areas you have covered. So almost, I think, you have done more of psychological part in a very in-depth manner. So I would say that the psychopathological basis, neurobiological symptoms, physiological aspects. So you have covered everything. So I think even people who have been doing psychology or the psychiatric even students would have abreast with the various ideas or various theoretical inputs that you have given. So that's really wonderful, and the physiological and psychogenic aspect. So that is also very important. How the clinical depression. Then you also talked about the anxiety. So different kinds of anxiety, OCD, the post-traumatic stress disorder, and what are the symptoms of all these things. And you also touched upon a very important thing: SAM axis and HPA axis, parasympathetic nervous system, and the influence of vagus nervous stimulus, that VNS. And you also, the other important aspect is that how the physiologically hormones and neurotransmitters also, the hormones, because you have given dopamine, serotonin, also adrenal. So how the role of each symptom or each hormone that would act upon for our physical benefits, right? And the cycle of interventions about things you have also touched upon. That is YIBT, that is Yoga Integrated Behavior Therapy. So that's a very important thing. And you just gave an example of a few asanas, because Tadasana, Uttasana, Pachamutyasana, and all those practical asanas and pranayama. So that is very important, because now the pranayama can be done even people with some certain physical disabilities also, right? So they can do the pranayama, the Chandra Pida Asanam, Sitali, Ujjayi, and Nadi Sudanam, Brahmari. Even yesterday you gave a very good demonstration on Brahmari, how the Brahmari is a very important thing. Even I every day do this Brahmari for the betterment, so that I feel more stressed. I feel more relaxed when I do Brahmari. And Kapalapati, that is also one of the important thing I used to practice every day. And the most important thing which you would highlight is the mantra chanting, Om mantra chanting. Because in Tamil we say A, U, Im. Am I correct, Sendil Raja? A, U, Im. That is the... Hello? Are you able to hear me? Hello?
Yes,
Hello?
sir.
Yeah.
Yeah,
Yeah.
that's a
Yeah.
very, yeah.
Yeah, normally we used to say, we can able to chant and kirtanas, visualization, and different kinds of meditation. Now we have a mushroom growth, and where you can have various meditation and yoga nitra, because that is also, because many people, they like savasana. Sendil Kumara Raja really brought out with all kinds of physical features and how.
And it must be spread in the society, and it must be put into action. At this juncture, I would like to thank the Vice Chancellor and Registrar of our university to grant through the integration of yoga therapy. And it is very